if you can, if we go a little bit over time, I guess that's okay. So, Kaveri, you can start.
Yes, sir. Sir, can you share the screen, sir?
Oh, you cannot do it yourself, can you?
No, sir.
Okay, so let me pull up your slides. I think. Okay. Okay, Kaveri, you should be able to see it.
Yes, sir. Thank you, sir.
You're
Good
welcome.
evening, all. So today we are going to discuss regarding, my topic is regarding immunodeficiencies and opportunistic infection. Next slide, sir. So first we'll see the introduction of immunodeficiency. So most of the time the immune system protects the body from germs and threats. So when we have a good immune system, we can fight against any infection. But sometimes it gets off at track and has weaker response to this threat when there is the low activity called immune deficiency, and it makes you less able to fight off against the infection, and it can result from the medication or from illness. So definition, immunodeficiency results from a failure or absence of the elements of the immune system, including lymphocyte, phagocytes, and the complement system. So what is immunodeficiency disorder? So that may affect many part of immune system. Most of these condition may occur with special white blood cell called T or B lymphocyte and do not function normally. As when you have a good immune system, how it can find, so if you have a good WBC and a neutrophil count, so you can fight against infection, and your body does not produce much enough antibodies. So there are two types of immunodeficiency disorder. So that is primary and the secondary. Primary are called as acquired, and secondary is nothing that anything that weakens your immune system and can lead to secondary immunodeficiency disorder. So primary immunodeficiency, so which have a immune system that does not work correctly. That means that the people of primary immunodeficiency are most likely to get, and they become very sick from the infection. And there are more than 400 types of primary immunodeficiency that vary in severity and which affects the how early they are detected. What is the primary to get what is the cause to get primary immunodeficiency? So it results from genetic mutations affecting one several component of immune system, which includes the cells and the proteins. These mutations can cause parts of immune system to be present in lesser quantities that the normal. So secondary immunodeficiency occurs when the immune system is compromised due to environmental factor. Example, outside forces include like HIV, chemotherapy, and severe burns and malnutrition. So examples for secondary immunodeficiency disorders are like AIDS, cancers of immune system like leukemia, immune complex disease, and like viral hepatitis. Hello, sir. Sir, not able to see the screen, sir.
You can see now, Kaveri?
Yeah, sir. It's
Okay.
sharing.
Okay. Hello, Kaveri. Is that the right
Yeah, sir.
slide?
It's scrolling, sir. It's not visible yet.
You cannot see it?
No, sir.
Now?
Yes, sir.
Okay.
Next slide, sir. This is done.
Yeah. Okay.
So management of immunodeficiency, treatments for primary immunodeficiency, which can include like preventing and treating infection, boosting the immune system and treating the underlying causes for the immune problems. In some cases, primary immune disorders like are linked with serious illness, which cause the autoimmune disorder or cancer, which also needs to be treated. So next one is like opportunistic infection. So opportunistic infections which may occur often or they are more severe in people with weakened immune system and in the people with healthy immune system. People with weakened immune system which include people living with HIV or which can be caused by a variety of germs like virus, bacteria and fungi or parasites. So like treatment was like as a prophylaxis like a fluconazole 6 mg per kg once daily from day plus 2 until the ANC is above 500. Acyclovir will be 250 to 500 mg per meter square per dose 3 times a day, and from day plus 1 to 90 CMV reactivation will be monitored weekly by CMV PCR from day plus 30 till day plus 70. As a pneumocystitis prophylaxis, cotrimoxazole at 5 mg per kg per dose twice daily. Weekly will be administered from the day of total WBC is more than 1000 and platelet will be more than 30,000. And encapsulated organisms like pneumococcus twice daily prophylactic penicillin, that is 125 mg per for age of below 3 years 250 mg and from day plus 90 until the vaccination. So these are the three stages when during the transplant, like pre-engraftment, post and the late phase. So as a prophylaxis, like when they get the bacteria, viral and fungi, like how we are going to treat. So this is a table explaining regarding that. So next is this is regarding the vaccination schedule. So next slide you can move, sir. So here is the vaccination schedule. So once the transplant done, when their immune system is completely weakened and when they have a new immune system, they are same equal to as newborn. So we have to start them with the vaccination schedule. So 6 months onwards we are starting like inactivated influenza. So that will be given as IM, and diphtheria and diphtheria pertussis and tetanus, that will be also as IM, and human influenza B, Hib and hepatitis B and pneumococcal conjugated vaccine as well as a route of IV, and 12 months like inactivated polio, that is IPV, and hepatitis A and typhoid conjugate and combination vaccination. So 14 months like DTAP and DPT and HIP second dose and HPV second dose that will be given as IV. And in 14 months PCV 13 and IPV and TCV. So this will be given as IV. And in 16 months DTP, DPT, HIP and PCV and oral polio vaccine as will given as IM. 18 months like HBV, HAV and for 24 months pneumococcal polysaccharide capsular vaccine that will be in the 24 month, which will be given as IM and meningococcal and MMR vaccine. And 48 months there will be DTAP and HIP.
Okay. Thank you.
Thank you, sir.
Thank you, Kaveri. Okay, any questions? Okay, so we can quickly move to the poll. Let me see if I can see it. Okay, so we launch the poll and hopefully we'll finish it in 5 minutes. Okay.